Good morning. I think we'll get started. We have a full agenda today. We've tried to put a lot of information in one short hour. We do have a little extra time after the session in case we have a lot of questions. So thank you for joining us today for our How to Maximize Employee Safety Amid the COVID-19 Pandemic webinar. This webinar is hosted by AM&T in partnership with Upstate Safety Services. I'm Carol Miller, the Executive Director at AM&T, and I'll be today's moderator. This webinar will be recorded, and a link to the webinar will be on our website at amt-mep.org. Our objectives with today's session is that we help companies protect your employees, understand what you're responsible for, help in organizing a response plan, and incorporate these protections into your daily routines using continuous improvement tools. As a disclaimer, this presentation is not intended to be legal advice. It's for informational purposes only. There is a list of references at the end of the presentation for source information so you can stay up to date as requirements are continuously changing and there's a lot to digest. We have two presenters today. We have Lori Mauter, and she's the Safety and Documentation Manager at Upstate Safety. Lori has 27 years of experience in the oil and gas industry and experience in health and safety and training. After Lori, we have a second presenter, Tom Enderby. Tom Enderby is our Lean Six Sigma principal consultant at AM&T. Tom has over 30 years experience in manufacturing and has worked in a variety of engineering, managerial, and leadership functions. Tom has helped many companies achieve millions of dollars in savings through the application of Lean Six Sigma principles. Our agenda today will be as follows, and Lori will be starting us off and talking about preparing the workplace.
All right, thank you, Carol. I'd like to start off our discussion about how to prepare the workplace with a review of NIOSH's hierarchy of controls. These controls are effective and protect workers from workplace hazards. These controls are used to help avoid injuries, illnesses, and incidents, to minimize or eliminate safety and health risks, and help employers provide workers with safe and healthful working conditions. As you can see, the most effective controls are at the top, and the least effective are at the bottom. At the top of this inverted triangle, we see elimination and substitution, with elimination being the most effective. Elimination involves physically removing the hazard. We're not able to eliminate or remove this virus right now, right away anyway, but we can eliminate our exposure to it, right? I mean, that's what we've been doing. We've been closing our doors until it's safe to reopen. The next most effective control is substitution, which involves replacing the hazard. So instead of replacing the hazard, lately, some of us have been able to substitute our workplace, in turn protecting ourselves from the hazard. But now it's time to get back to work, right? So as we go down the hierarchy, next we come to the engineering controls. These controls involve isolating employees from work-related hazards. In workplaces where they are appropriate, these types of controls reduce exposure to hazards without relying on worker behavior and can be the most cost-effective solution to implement. So some of the examples of engineering controls include, and you've probably seen some of this stuff on the news, installing high efficiency or HEPA air filters, increasing ventilation rates in the work environment, and installing physical barriers such as clear plastic sneeze guards, which you may have seen at some of the big box stores lately. Arranging workspace to allow for separation, utilizing product transfer aids like incline shelves or push boards would help people having to come into close of contact with each other. Creating operator boundaries around conveyors or where the operators would stay within those marked areas is another way to do that. Creating aisles that are only one way so people don't need to pass each other in close proximity. And possibly, if you can, remove doors to avoid touching doorknobs or creating places where people would go through touching doorknobs or door frames. When we can't engineer out our hazard, we have to move to the next level on the hierarchy, which are the administrative controls. These controls require a change in people instead of the workspace. So we're changing people and how they work. So for instance, we're all pretty familiar with the social distancing that we've been dealing with. It felt a little weird, and it still kind of does, but it does change the way that we move, and it changes our practices, so it can keep us safe. I've listed a few ways to accomplish this, like reducing the number of people permitted inside a facility at one time. This would create less chance of employees from coming into contact with each other. You can also remove gathering places like coffee stations, water coolers, snack areas, and then also place where food is stored, like refrigerators. So by removing that refrigerator, you're taking away that frequently touched spot where people would be holding on to the refrigerator handle. As far as conference rooms goes, you can create new requirements for the conference rooms, like allowing only half capacity into that room at a time, or even limiting the number of chairs within the conference room or the break room. Or it could be as simple as just placing a sit or do not sit sign on every other table so people are aware that we need to keep this distance. So during deliveries, you might also consider allowing the person who's delivering the goods to sign for you, so you don't have to sign and get too close. And then you might want to consider quarantining the inbound goods for a period of time until it's safe to handle them. So lunch breaks and shift work, there are some administrative controls that we can put into place. So there are many ideas for lunchtime and breaks, like alternating times for different departments, or letting one group use the break room at a time while the other takes a break in their car or outside. Consider leaving enough time for the worker to walk the extra 5 or 10 minutes it takes to get to the car or vehicle, and then the time it takes to come back. Or maybe even schedule a food truck. I mean, those are pretty popular right now. Mm-hmm. Also, put the maximum capacity allowed within the lunch or break room, and ensure that there's no congregating together. It'll soon be warm enough. I think tomorrow it's supposed to warm up. So now is the time to take advantage of those outside workspaces, or sorry, pavilions and picnic tables, as long as we're going to consider that 6-foot distance. And again, if possible, use separate doors for entry and exits of the lunchroom or break room. As far as shift work goes, there are a couple things you can do. Might be to start shift times in waves to help with social distancing, spread them out maybe 5 or 10 minutes apart. Also make sure you identify your entry and exits. If you've been to Walmart lately, they've got a definite entry and exit to Walmart. You can only go one way, in and out. So possibly you might need to have somebody monitor that, but that's totally up to you. Adding shifts in order to keep workers separate is another idea, or assign the same workers to the same shifts with the same co-workers every day, so they're around the same people all the time. Avoid job rotation is another idea to keep people within their work environment and responsible for their own space with cleaning it. Prior to entering, you might want to have people, during shift change, have them remain in their vehicle until it's time for them to begin, in order to, create that distance while walking in. There's not a lot of passing between two people, and it would avoid congregating within the entryway. And also in the parking lot, if you've got enough space, if it's not too limited, maybe designate every other parking space as a place to be able to park. That's, of course, only if you have enough spaces available. Keep as many doors open as safe and applicable during shift change. I know fire doors you can't prop open, but if it's just a door you need people to walk in and out of, maybe prop that open so people aren't grabbing onto those door handles again. And then disinfect between shifts. So a few more administrative controls. These would be considered our practices. So instead of social distancing, just a few more practices that you might consider. Which I'm sure you're doing already, or you will do, is to encourage and promote the frequent and thorough hand washing. You're going to go that 20 seconds or more singing happy birthday, or the song that lasts about 20 seconds. And encourage, of course, sick employees to stay home and discourage handshaking. It's also important to keep your customers informed about your practices and request minimal contact with them if they're sick. Provide waiting areas for customers. Also consider that 6-foot distance in that waiting room. Your customers will be very happy to hear that you're also taking care of their safety as well as your own. Okay, so this is an example of a shop floor where you might see, I mean, you could see it's a normal, this is our old normal right here. So we've got a lot of different workspaces, there's no travel path, no path of travel, no directional travel. All the workplaces are real close together. And we'll just show you what it might look like now with our new engineering controls and administrative controls after they're put into place. So as you can see, we've implemented a one-way walking floor plan with stops at intersections to ensure a 6-foot distance between two people rounding a corner. Workspaces have been temporarily eliminated. I'll say temporarily because hopefully we get back to normal. So eliminated for the social distancing. In the upper right-hand corner, we've also put yellow markings on the floor around workstations where operators would need to stay within those yellow lines. And we've also added physical barriers between workstations with room dividers. In this case, we can't change the direction that our workers are working, but if you can do that and change their direction, it's probably best not to have workers facing each other. At the bottom of that same section is the sampling section. So we've eliminated every other workspace in order to create that distance as well. So as we go to the bottom of the floor plan, you'll see that we've also eliminated space on the complete right-hand side. We've just eliminated an entire section of workers or workspaces. And then on the left, we've done every other workspace as well. And we've also added some sneeze guards in between those workspaces to, again, create, that would be your engineering control to keep that space and create a better work and safe environment. Okay, so now we've reached the bottom of our hierarchy and we're at the PPE. So we've reached that final and this is currently obviously a widely sought out method of controls on the hierarchy, which is our PPE. It's also covered by OSHA's standard. And now while engineering controls and administrative controls are considered more effective in minimizing exposure, PPE is also needed to prevent certain exposures. This is always the last line of defense when it comes to safety. When COVID hit, we were not prepared with engineering and administrative controls. So we resorted directly to elimination, substitution, and PPE. So while correctly using the PPE, we can help prevent some exposures. It should not take the place of other prevention strategies like engineering and administrative controls. There are many types of PPE on the market, like respirators, gloves, goggles, face shields, and face masks, just to name a few of them. Employers should check the OSHA and CDC websites regularly for updates about the recommended PPE that you should wear. So let's discuss respirators real quick. If you've never required respirators, not face coverings, but actual respirators at your facilities before, and you are going to require them now, you must follow OSHA's regulation for respiratory protection, which is standard 29 CFR 1910.134. So currently the most commonly talked about respirator is the NIOSH approved N95 filtering face piece. And this must be used in context of a comprehensive written respiratory protection program that includes medical exams, fit testing, and training. If you can't find an N95, you can use an alternative, which are listed below, the N99, the N100, and so on. But again, you must have that respiratory protection plan in place. So what's the difference? There are many types of respirators on the market, but what's the difference between the N95, surgical masks, and homemade cloth coverings that the CDC recommends? The N95 is NIOSH approved, and it'll say it right on the mask itself. If it doesn't, then it's not. And it protects airborne hazards from getting into your system and into your lungs. The surgical mask is not NIOSH approved, and it does not protect airborne contaminants. It only protects from biological hazards, so not airborne, bodily fluids, things like that. So what it's doing is preventing your bodily fluids or your air droplets from getting any further than they need to past that mask when you cough and when you sneeze. So the homemade face coverings, these are the ones the CDC is allowing us to wear, recommending us to wear. That's because, because of the lack of supplies of the N95s, they are allowing this. So they need to be worn in public settings where other social distancing measures are difficult to maintain, especially in areas of significant community transmission. So the cloth coverings may prevent people who don't know they have the virus from transmitting it to others. And again, they're not NIOSH approved. They should not take the place of an actual respirator, an N95. They only keep your airborne droplets from traveling too far. So still try to keep that 6-foot distance. So those coverings must fit snugly, be secure with tied or loops around the ears, and have multiple layers of fabric and allow for breathing without restriction. And don't forget to wash them, keep them clean, and dry them without damaging the actual shape of it. These are more similar to the surgical mask, and also be aware when removing and washing hands afterwards. Okay, so as far as PPE, when you're considering cleaning, in the world of cleaning, and I'm going to talk a little bit more about cleaning in a minute, but your cleaning staff will need to have a variety of PPE, including gloves and gowns. When you're wearing gloves and gowns during cleaning, make sure that they're compatible with the disinfectant that's being used to avoid disintegration and breakdown of that material in the glove itself. They should be worn when taking out the trash as well. And then after trash removal, also remove the gloves and wash your hands after that. And then guide your employees to report and replace any PPE that's damaged if they've got holes in it, or again, if it's disintegrated, to get a new pair. So if you don't have gowns for cleaning, you can wear aprons or other coveralls, things like that. But make sure when you're washing those things, make sure you follow the recommendations for the fabric that you're using, and we'll talk a little bit more about laundering items in a minute. And when you try to have a 30-day supply of gloves or respirators, if you're going to use those, just make sure you try to have that 30-day supply if you can for those replacements. Okay, so as far as cleaning and disinfecting goes, we've talked a little about the PPE required to be used during cleaning and disinfecting. Let's talk about creating a plan for cleaning and disinfecting. So the CDC recommends these 3 steps: develop your plan, implement your plan, and maintain and revise your plan. But before I get too deep into the actual plan, let's just talk a little bit about some of the terms that are out there. I want to just verify the difference in them. So cleaning of visibly dirty surfaces followed by disinfection is a best practice measure for prevention of COVID and other viral respiratory illnesses in the community setting. So routine cleaning is achieved with soap and water to wipe germs away, okay, while disinfecting is achieved when using chemicals to actually kill viruses. So cleaning the dirt, if there is any dirt or grime or grease, is really the first step for disinfecting. You may consider deep cleaning as something that would be done by a third party, like coming in and providing more comprehensive cleaning using advanced technologies or more aggressive cleaners or disinfectants. Maybe they can reach higher places, things like that. So think of it as, comparing vacuuming your rug with a vacuum as opposed to getting it steam cleaned by a professional. So you can tell that there would be a difference there. So your first step to creating your cleaning and disinfecting plan would be to develop the plan. So we're going to determine what needs to be cleaned. So first you might want to determine whether you need to do the cleaning and disinfecting. So as you can see on the right-hand side, we have how long does the coronavirus live on surfaces? So as you can see, so on stainless, let's see, like hours. So on aluminum, it says it can last 2 to 5 hours. And then on metal, it can last up to 5 days. So it ranges from anywhere from 2 hours to 5 days. So if your company has been closed for 7 days or more, you might want to consider, maybe only washing or cleaning would be needed as opposed to a full-on disinfection. If you have triggers, such as active employees being tested positive for COVID-19, or if you have a presumed case, not a positive case by a test, but maybe a presumed case, maybe you can opt out of the disinfecting and the cleaning. And that's a big but. it may be worth it to just go the extra mile to ensure that your employees feel safe coming back to work, that you've done everything that you can. Okay, so we have many surface types that need to be addressed, not just hard surfaces. There are protocols for each type of surface and how it should be cleaned. So hard surfaces should be cleaned if dirty. So clean means washing the dirt away, and disinfected. And soft surfaces like couches or rugs, things like that, should have visible dirt removed and cleaned with a cleaned and disinfected with a product that's made for that surface. For electronics like tablets, phones, monitors, check for cleaning instructions. Some chemicals could damage the screen that you're cleaning. So you might want to consider putting some wipeable covers over keyboards or tablets. And so you're able to wash that and disinfect it. If there aren't any manufacturing recommendations, just use an alcohol-based wipe or spray to clean that space. So back to our aprons and our coveralls. If you have anything that needs to be laundered, wash it on the warmest setting, and then wear gloves when you're handling those pieces of material. So wear gloves, don't shake out the jacket or the coveralls. That's just going to spread the germs again. So don't shake them out. Again, follow the instructions on the temperature, but the warmest setting possible. So, that's how you would handle laundering. If you're vacuuming, try to use a vacuum with a HEPA filter if possible, and wait until the room is emptied to start vacuuming, and turn off the HVAC system so particles from vacuuming don't circulate through the facility. Okay, so now that you've determined the types of surfaces at your facility, it's time to identify where those surfaces are, like shared spaces, shared maintenance equipment, shared tools or other equipment like forklifts and pallet jacks. Also consider PPE like gloves or helmets and eye protection that might be shared, or even if it's not shared. And every other everyday items like light switches, barcode scanners, even vehicles that are shared on a scheduled basis would need to be disinfected before somebody else is taking over and using it. And also consider cleaning throughout the day. Maybe a couple times during a shift, a person would clean their space to ensure that there's no transmission the next time someone comes on shift. And another good idea is to, in order for cleaners to know and remember exactly what to clean, you might want to stick little stickers or hot zone stickers on places like the backs of chairs, which you might not think of as a place that needed to be cleaned, in order to remind cleaners or those who are cleaning what they need to get in contact with. So once you've decided you need to clean and disinfect your facility, you need to decide whether it's a big enough job to hire a third party or to do it yourself with your own workers. So ensure that you have the appropriate plan, which we're talking about now, as well as consider the safety of the custodial staff and other cleaners that would come in to your facility. So for your own employees, you would need to provide and pay for the personal protective equipment and have enough cleaning materials on site and disinfectants that they would be using. And you also need to train those who are doing the cleaning on the actual chemical that they're working with and how to apply it in order for it to be effective. When you're doing the cleaning, make sure that only the cleaning staff are present during the actual cleaning, in order to prevent contamination of the area. Okay, so now we're down to step 2. We're going to implement our plan. So when we implement, again, I mentioned again, clean visibly dirty surfaces with soap and water, use appropriate cleaning and disinfecting products, and always follow the directions on the label. Okay, so disinfecting doesn't have to be done just with bleach or alcohol. There are a lot of other options out there. The EPA has a list of other chemicals. There's about 400 other chemicals. If you click on the link or copy and paste that link to your browser, it'll take you to this table, and you can sort by the registration number, active ingredients, product name, and then on the right-hand side is the contact time. So you can sort by any of those things. always check the contact time when selecting a disinfectant. Okay, so the contact time is how long you should leave the disinfectant on visibly wet before wiping it off. So instead of spraying a paper towel and wiping it down and moving on to the next item might not suffice depending on how wet that paper towel is. So something like bleach only requires 1 minute of contact time where the surface is visibly wet before wiping it, while others might require 10 minutes. Like hydrogen peroxide that you see on the screen, you would need to leave that on the surface for 10 minutes or more in order for that disinfectant to work. So this is going to affect cleaning and disinfecting times greatly. But always follow the manufacturer's instructions for use on all cleaning and disinfecting products, and always consider OSHA's HAZCOM standard before introducing new chemicals into the facility, just as a reminder. So if you can't find any of the products and you do have bleach on hand, you can dilute household bleach if it's used for the surface, if it's okay for the surface that you're using it on. Again, they consider a 1 minute contact time a good amount of time for it to kill the virus. And make sure that the bleach that you're using is used for disinfectant. So the bleach that you're using for your colored clothes might not be appropriate for disinfecting. So make sure you check that as well. Always provide ventilation when you're mixing those two together. And remember, the bleach will only be an effective for disinfection for up to 24 hours. So making a large batch of water and bleach might be counterproductive. You might need to make smaller batches just in spray bottles. So unless you're going to use that entire gallon of water and bleach, you might want to just make smaller bottles at a time. Okay. So always remember, there is a difference too between hand sanitizer and bleach or alcohol that you're going to use, between hand sanitizers for your hand and for using it for cleaning surfaces. For hand sanitizer, they recommend 60% alcohol, and for surfaces, they consider 70% alcohol. And remember, never mix chemicals that may create a hazard, because mixing bleach with ammonia or acids may cause a whole other hazard in your work environment, like toxic gases that cause coughing, shortness of breath, burning eyes, or even pneumonia. So these can cause a lot more other health issues than you can imagine. So read the labels and never mix these chemicals, bleach and vinegar, bleach and ammonia, bleach and rubbing alcohol, or hydrogen peroxide and vinegar. So not only do you need to provide cleaning supplies for your facility, but you do need to provide cleaning supplies for your employees. So provide a spot for washing hands with soap and water with towels, and a trash can for the towels, or a hot air dryer is adequate as well. If you don't have soap and water, sanitizer, again, like I said, 60% alcohol is also acceptable. And then post signs in the restrooms to remind workers to wash their hands, for that 20 seconds or more. And remind them to wash their hands several times a day, like entering the facility, after breaks, after using the restroom, sneezing, coughing, and before and after eating lunch are also good ideas. So now we've come to our third step. We've developed our plan, we're implementing it, and now we're maintaining it and revising it. So keep doing what you're doing as far as cleaning and disinfecting goes, based on the supplies that you have and the availability, and then adjust as needed based on the availability. Always check to make sure that those are still the recommended chemicals or disinfectants, and you may need to change those. You might need to change those as things change in the world. But continue with your hand washing practices and your 6-foot social distancing, but also train your people on this plan, and then keep records of those training, and also keep records when you're doing the cleaning. So maybe provide a checklist where you're going to, mark off the date your facility was cleaned, the times, the location of the cleaning, who performed it, and what disinfectants that you used. And that's definitely not all inclusive, but just some good ideas to follow. And again, keep those records on hand and update those as update your plan as and when it's revised. Just a few more reminders. When you have PPE on site, you'll need to train them how, not just here it is, wear this. You also need to train them on how to put it on, take it off, how to wear it, how to maintain it, and then allow masks to be worn over the nose and mouth to prevent spread of any droplets. Train them on proper etiquette for sneezing and coughing, into your elbow as opposed to just out into the air. And then training them on those chemicals that we mentioned, the disinfectants, and then what PPE they need to use when they're using those chemicals. And again, we're going to talk about a response plan in a little bit, but you would need to train your employees on the pandemic plan, and when it's the first time, and then when it's also updated. And again, keep those records of the training, because if you didn't write it down, then they consider it doesn't even exist. So yeah, definitely write down those keep those training records, which you would need to put in there your, who was trained, what they were trained on, the date they were trained, their name, and a signature possibly as well. So visitors and contractors are very important in this process as well. In saying that, their entry should be limited to the extent feasible. You may want to provide a screening for them as well, a checklist, asking them a few questions like, have you had a temperature? Do you have a cough? Do you have trouble breathing? And deny anybody who's had any of the symptoms with exposure and symptoms. If they're permitted to enter, require or provide face coverings. Remind them of your rules, such as social distance and good hygiene practices. See to it that they take direct routes to work areas instead of stopping here and there on the way, and no unnecessary meetings with anybody on the way, and make sure they're following your rules on the floor. If they refuse to wear a face covering, you can deny them entry to your facility. Use dedicated meeting rooms where possible, and disinfect common shared surfaces between those meetings with the visitors and the contractors. So contractors might need a little bit more extensive training than visitors. The contractors are similar, but they do have a little extra. So maybe provide them with more extensive training, like a computer-based safety training module, and then provide a copy of your response plan or direct them to the environmental health and safety person rep for a copy of that.
Great. Thank you, Lori. That was great. There was a lot of information in there that was very helpful. I'm going to turn it over to Tom to talk about maintaining the workplace and applying some continuous improvement methodologies to do that.
Thanks, Carol. Wow, we've got a lot to do. And you condense some of the things that Lori just said. We have to not only add disinfecting practices, like I've listed in the table down here below, for having to disinfect work surfaces, conveyor belts, containers, doorknobs, forklifts, and floors, but also too, we have to change and modify some behaviors within our workforce around PPE, making sure the proper PPE is being worn, making sure it's being worn properly, make sure we're obeying social distancing practices, making sure that we're hand washing frequently, and also too that we're maintaining the proper etiquette around sneezing and coughing while we're out there on the shop floor. Now, how do we incorporate these into the routines that we've already established during the day? And a great way to do this is to take a look at the 4 laws of behavior change and how we can change employees' behavior. The first law would be around making things obvious. Second law would be around making things attractive. What's in it for the employee? And also too, what are the consequences of not following the proper protocols and the proper practices that we've outlined? The next law would be taking a look at how do we make it easy? If it's difficult for the employees, well then they're not going to conduct the practice. And also too, what we need to do is we need to make it rewarding and we need to make it satisfying for the employee as well too. Now, if we put all those together, we should get the desired behavior that we're seeking. If we continue on, what I've shown is some of the tactics for continuous improvement underneath each balloon that we can use to work on each one of these laws. And we're going to be touching on those in the next few slides. Now, we mentioned signage on that first slide. And let's begin the discussion about, well, okay, these need to be strategically placed throughout the facility, serve as cues for good habits. We also need to have these to serve as a reinforcement mechanism after your initial training. What we had to be aware of is that, well, okay, we're going to be conducting a lot of training to begin with. And it's going to be covering a lot of things that Lori mentioned. We have to be aware that, well, okay, after about 48 hours, we're going to be losing about 70% of that. And so we need these visual cues out there to keep reminding people of what to do. Now, another way to make things obvious for people is standard work. And standard work is just a work instruction that outlines the one best way to do something. We need to make it visible, we need to make it simple, and we need to make it easy to understand. Now, what I've done over here on the right is just created a simple example over here of putting a face mask on and taking a face mask off. So you can see, just outlined the steps over here on the left. Then also too, created some pictures about how to do it correctly over here on the right, and just hit on some key points that people should follow while they're conducting that task. Same holds true for disinfecting. In fact, Carol mentioned, okay, the playbook, manufacturing playbook, and I took this snippet right out of that playbook. And here shows some standard work for disinfecting. Okay, you take a look at the first line here. This would be what you want to do for work surfaces. This is how you would, areas you'd want to concentrate on for the content. This would be for the disinfectant that you'd want to use. This is the way you'd want to disinfect. And this would be the frequency that you'd want to conduct the disinfection. Now, when we have standard work, what we want to do is we want to audit against it. In those examples we showed previously, what we want to do is we want to have those placed at the workstation, not only as constant reminders for the employee, but also too to serve as cues for managers and supervisors as they walk by. Now, how can we capture those audits that I was just talking about? Well, there's a great tool called Leader Standard Work in our continuous improvement tool belt. And really what leader standard work is what we want to do is we want to establish a set of routines that we want our leaders to follow religiously during the course of the day. And so how can we incorporate some of these practices, that we have to take on now with the COVID pandemic into our daily routines? And I just outlined over here what we could possibly do in the morning. And I outlined them in red over here is like, well, okay, things that we'd have to add on to the beginning of our day is like, well, okay, we want to monitor and check our employees even before they come in the door or at the very start of the day. And this would be the team leader's responsibility. And also too, what we want to do is we would want to make sure that the supervisor is made available in case that team leader needs any help. And the manager should make himself available during that time as well too. So that's just a few examples of ways that we can incorporate, some of these audits and some of these practices into our daily routines for our leaders. Now, we talked about audits, and there's another tool out there for auditing that we can use, and this is actually mentioned in the playbook that we're recommending and that Carol mentioned earlier. It's something called layered process audits. And it's along the same lines of what I was just talking about for leader standard work, but it concentrates more on higher risk processes. And then also too, what it is, the layering, what you do is you'll involve more people outside of the leadership team, like engineers and coordinators, and you would layer them, and layers would be daily audits, weekly audits, and monthly audits. Now, moving on to the next law of making things attractive. One of the big things we need to do is we need to make sure that people are aware of the consequences of nonconformance. Need to make sure that they're aware of the health risks involved, the hospitalization time that's involved, okay, the symptoms that they'll have to undergo if they get infected. And also too, it was like, well, okay, if they get infected in the workplace, they're likely to spread it to friends and family. Another thing that we need to do is we need to keep in front of people is the effect of absenteeism, how it affects business continuity and the possibility of lost wages. Thing is we don't want to be this plant over here that Tyson went through, where 40% of its workforce, okay, got infected just in the span of a week. And also too, we need to be aware of, okay, there could be legal implications down the road. We're going to be hitting a second phase in fall. What we had to do is we need to make sure that we're set for that second phase, as well as making sure that we're set for possibly a lawsuit pandemic at that time as well too. So how can we make it easy for employees? Well, we put visual controls in the workplace, making things visible out there right at the workplaces, such as like what the PPE is that they should be wearing. You should be placing supplies as close to the line of the work cell as we possibly can. And then also too, what it is okay, we need to make sure there's an easy way to identify that the supplies we need, that we've got a proper supply of them, and it's easy to detect. And actually this should be like on an audit plan that we mentioned earlier with Leader's Standard Work. Now, how can we make it more rewarding and satisfying for employees? Well, we need to make things team-based. We need to have employees involved with the changes that we're making in the workplace. And a great tool to use for this is what we call an FMEA. FMEA stands for Failure Mode Effects Analysis. And what we do with an FMEA is we'll take, each one of the process steps. We'll calculate the risk associated with them, depending on, how severe it is, what's the likelihood of occurrence, and what's our ability to detect it. We'll give it a score. And if you take a look at the gray line down here, it's like, okay, we give this process step a score of 900. And how do we outline some countermeasures, okay, to protect ourselves against that and lower the score? And that's what we've done here. And we've established some countermeasures over here that would bring the score down to 200. Now, this would be done in the team-based approach. You want to involve all your employees. This will make their work more interesting. And then also, too, along the line, you'll be testing their knowledge about what they know, about what they need to do to protect themselves during the COVID pandemic. Now, to make it rewarding and satisfying, again, we should get some metrics out there. Create an environment for positive reinforcement. You should be tracking and trending audit scores, which would be a leading indicator. And making sure that we're recognizing good behavior. I incorporated one of these boards down here in the right-hand corner when I was working at Kraft, and I was a little skeptical at first. But what we did is we made mention, and people put on the board when they noticed people doing the proper behaviors. And I tell you what, it really took off, and it really did promote, okay, the proper behavior. Also, do we need to make sure that we're celebrating success? The thing is like, well, okay, we go a week with no non-conformances in our audits. Well, hey, let's celebrate. And with that, I'll hand it over to Carol.
Great. Tom, that was great. There was so many interesting things about how to apply continuous improvement techniques to our scenario currently. All right, so I'll turn it over to Lori.
Thank you. Okay, so should self-distancing fail to prevent the spread of the virus, it's also important that employees be monitored, observed, and screened for the display of symptoms. One of the most, so you have self-screening, you have observation, and then you have monitoring. So one of the vital aspects of detection involves self-screening. So you might want to issue a self-screening checklist for all employees to conduct voluntarily at home prior to returning to work or coming to work. The screening should consist of the following questions. Do you have a temperature of 100.4 Fahrenheit or greater? Do you have a cough, shortness of breath or difficulty breathing, or unusual fatigue? If they're answering yes to any of those, they should stay home until it's safe to come back to work. Employees who have symptoms, as far as observation goes, of if you have symptoms of fever, cough, or shortness of breath upon arrival at work, or become sick during the day, they should immediately be separated from other employees and customers and visitors and sent home. If an employee is confirmed to have COVID-19 infection, employers should inform fellow employees of their possible exposure, but make sure that you keep the person's name confidential and follow any of the CDC public health recommendations for community-related exposure. All right, for the third way to screen is the monitoring of by the employer. So employers can set up a monitoring station at the facility's entrance or at the parking lot entrance. And if you implement this, please remember to consider the following things. Have a health screening team that will monitor symptoms. Close any alternative entrances that you have so people can't bypass the screening station. And use the no-touch thermometers to evaluate the temperatures. So all these things, and this definitely is not all inclusive, but there's a lot of things that go along with health screening. So if you do have a case, let's say you do have a case. So let's say you have an employee that arrived at work, and we'll call him Robert. So Robert's arrived on site at 7 a.m. He had no symptoms. Around lunch, he began to show some symptoms of a cough and a fever. We'll say self-proclaimed he started to feel poorly. So he needs to report to a supervisor, and then you need to act at this point. So first you need to report it to a manager and an appointed pandemic coordinator and an isolation coordinator as well. They might be the same person, but all these things need to happen. So you need to escort Robert to a room, give him a mask and some gloves, and also everybody else that's in the room should have that PPE as well. Fill out a suspected COVID-19 case form. There is one of those in the playbook that is a resource at the end of this. And again, keep their name confidential. And then you would need to clean afterwards any areas that the person was in or touched in the facility. So you would want to close off those areas of that were visited by the person, increase the ventilation in that area, and possibly, if you can, wait 24 hours or as long as practical to do that cleaning. That would, keep less people from getting in contact with the droplets. So always a good idea to do that. And then you would need to clean any of the areas that they had touched or been in. As far as getting back to work after having COVID, so when can they return to work? Well, it depends on a few things, but always, in all cases, use the guidance of the physicians and the local health department before anybody should come back to work. So currently the recommendations are based off of a couple things. So on the left-hand side, you see you have a person who has stayed home. People with COVID who have stayed home and self-isolated will depend on whether you had a test or not to determine whether you're still contagious. Okay, so there are a bunch of different requirements there, and they are all and requirements. So you can see that 72 hours, symptoms have improved, and you've stayed home less than 10 days. So it just depends on if you've had that test or not. People who did not have COVID-19 symptoms but tested positive anyway and have stayed home have another set of requirements based on whether they had a test to determine if they were still contagious or not. So those things need to be considered before they discontinue self-isolation and consider coming back to work. So earlier I mentioned a cleaning and disinfecting plan. This is basically going to determine what things you need to have in a response plan. So within your response plan, you would have your cleaning plan. They're going to be different based on the industry size and the risk that you have, but you should have some of these things or all of these things within your plan. Identify a response team, discuss PPE, disinfection measures, all the way down to if you have a violation in your facility of somebody not following the proper procedures of your policies. So before the person or people come back to work or on the day that they come back to work, they should be trained on this plan. Again, it's going to include all of those things that I mentioned in the last slide. And make sure that plan is accessible to those who need it, whether it's electronically or paper but make sure that it is accessible for them to be able to refer back to. And then train people on that initially, and as it's updated, as we know, this is a fluid situation, so your plans might change, so make sure you train and document that training, again, with all the appropriate information like the name of the person, the date. Records are always very important to keep, especially in these times.
Great. Lori, thank you so much. I just want to highlight some resources that are available. This is where we drew our information from to put together today's webinar. There's a multitude of sources, and I think that's part of the reason why this is such a complicated and difficult topic for us. You know, there's sources for the CDC, from OSHA, from the National Institute of Occupational Safety and Health, the Equal Employee Opportunity Council, and then there's a number of insurance references. Please avail yourself of these. It's a great a set of information out there. We also, as we mentioned, will be providing a back to work playbook. There's a link to our website. I will also include that information in the email response that we're going to send to folks after this session is completed. This material is copyrighted, but we will be providing it to folks. And we want to thank you. And if you have any additional questions, you're welcome to reach out to AM&T. The contact information is there. I'd like to thank our speakers today, Lori and Tom. You guys did a great job. It was a very informative session on how to maximize employee safety, which is one of our #1 concerns. I hope you all found this valuable. The webinar will be recorded, and a link to it will be on our website at amt-mep.org, as well as the playbook, as well as the slide deck. After the session, we're going to send out a short survey via email to get your input based on the session, as well as to get your feedback on any other topics that you would find helpful. I love the PPE training idea and quiz. I think we'll move forward with that. And I want to thank you again for joining us today, and be safe.